Hello, my amazing healthcare warriors. Are you preparing for the OET speaking test and feeling like, uh, these role plays are more nerve wracking than a 12-hour hospital shift without coffee? Well, take a deep breath because today we are going to crack the code to OET speaking together. I'm not going to throw random tips at you. You are getting a real role play card, a checklist you can actually use, and one not so great response so you know what not to do, and then a perfect response with full analysis so you can walk into your test with confidence. Let's make OET speaking your comfort zone. Ready? Let's go. First, we will see the checklist for a powerful role play. The first one should be a warm introduction. You have to start with a polite greeting. State your role and confirm the patient's identity. Set a calm tone. Okay? The second one is understand the scenario. Don't jump into robot mode. Ask open ended questions in order to gather relevant information first and address each bullet point clearly. Treat each bullet point like a mini goal. Don't skip them, but blend them naturally into your conversations. And the fourth one is empathy, empathy, empathy. Don't just deliver information. Try to connect with your patient. You can use phrases like, I can imagine that must be tough, or it's completely understandable to feel that way. Got it? Try to connect with your patient. Avoid medical jargon. Speak like you would to a non medical person. Instead of hypertension, say high blood pressure. Okay? Try to use non technical terms and check for understanding. Pause and you can ask things like, does that make sense? Or you can ask, like, would you like me to explain that part again? Got it? And close professionally. Summarize what you have said, thank them, and then explain the next steps. Here is a sample role play card. The setting is hospital, surgical ward, and now we are talking to a 40-year-old patient who has just undergone an appendectomy. The patient is anxious about pain, recovery, and going home. So in the task card, you would see these type of messages where it states reassure the patient about the success of the surgery, explain common post-operative symptoms like mild pain fatigue, advise on pain management options, provide home care instructions, rest, light activity, follow-up, encourage patient to ask questions or express concerns. As I told you, we are just going to see not so good example, not so good response, and then later we will see the best response. Okay, so this one is not so good. Hi, I'm your nurse. You had your surgery already and it went okay. You might have some pain now, but we will give you your medicine for that. Just rest and don't do anything hard. You should be able to go home soon. Do you have any questions? Did you see what happened here? And what's wrong here? The tone is dull and rushed, lacking warmth or reassurance. And there is no empathy, or you're not trying to connect with the patient emotionally. Each point sounds like bullet list being read out loud with no smooth flow. The patient is not at all engaged, right? No encouragement to share feelings or concerns. Language like, okay, some pain, and go home soon is very vague, and these words are not patient centered at all. No check for understanding. You're not asking any open ended questions, and you are not asking questions whether the patient has acknowledged what you told. No personalized explanation. So, this is not a good example. Let's see the best role play. Good morning. My name is Sarah, and I'll be your nurse today. I understand you have just had an appendectomy. How are you feeling right now? I'm still a bit drowsy, and honestly, I'm really nervous about what's next. I've never had surgery before. That's completely understandable. It's normal to feel anxious, especially after your first surgery. But I want to reassure you, it went really well and you're recovering just as we expected. That's good to hear, but will it hurt a lot? You may experience some mild pain and fatigue over the next few days. That's part of the normal healing process, but don't worry, we will manage it. You will have access to pain relief medication that we will adjust based on how you're feeling. You're not alone in this. And once I go home, what should I do? Great question. When you're discharged, make sure to rest well for at least a week. Gentle walks around the house are fine, but avoid lifting anything heavy. We'll give you a follow up appointment date, and if you notice anything unusual, like heavy fever or sharp pain, you should contact us immediately. Thank you, that really helps. Of course, before I go, is there anything else on your mind or anything you would like me to explain again? Now, I'll tell you why this one is the best role play. Here you can find it is very warm and professional tone, right? Sounds like a real human who cares. Empathy front and center. Patient's emotions are acknowledged throughout. Structure and flow. Each bullet point is addressed naturally and clearly. Then, if you see the structure and flow, here each and everything is addressed in a very natural way and clearly. The nurse pauses, asks questions, and checks understanding then and there. And the response is based on what the patient says, not just what the card says, right? It is very fluent, clear, and appropriate language has been used. Medical terms are explained in simple words. So, giving all these reasons, this example serves as the best role play. So, the next time you practice a role play, you have to ask yourself, am I just ticking boxes or am I communicating like a real professional? Remember, OET speaking isn't about sounding perfect. It's about sounding like you, a caring, competent, and a confident healthcare provider. You have to use the checklist also. Remember to practice the role play aloud. Rewatch this video, record yourself too. That's all for today's video. Kindly like, share, and subscribe for more OET tips. Bye bye.